Hi, my name is Anaesthesia, and today I'll be completing ACDN Practical Assessment 31, setting up for anaesthesia, and this is attempt 2 of this assessment where I'll be going over a few points that I missed in my last video assessment, such as the pressure testing, soda line chart, and drawing up medications. So, we have correctly turned on the oxygen canister here, and then we want to turn the flow meter on to 3.0 mils of oxygen. Then we want to close the popper. Squeeze out all the air first because you want to start with it fresh. You want to make sure everything is intact and is connected. So the rebreathing tube, the rebreathing bag here. Then we want to close the pop-off valve. Then we want to be placing our thumb over the end of the rebreathing tube so absolutely no air is escaping. Now, you can either manually count in your head or you can count out loud, but you want to do for 20 seconds now until the bag inflates on its own. You want to be checking for any tears, leaks, holes or rips in the bag, and you want to make sure that the bag is inflating until no creases appear. Beautiful, we are almost there. And then you want to give it a gentle squeeze. Now we want to open the pop-off valve, leaving our thumb on and expelling that oxygen out. And then we want to turn the flow meter down. We have now successfully pressure tested the machine. So this is our anaesthetic machine here, and this is our soda line machine. We have our chart which we place here, and then we place the date change here. So this gets printed off a new one every single time. As you can see, 4.5 hours have been used on the soda line chart. So there's about 1.5 hours of viability left before it starts to expire. We have a 6 to 10 hour expiry range for the soda line. We don't want to be going off the colour of the granules, we want to be going by the date change and the soda line chart here. Now we will draw up the sedatives or the pre-medication for today's procedure. So today we have Jesse Peters, who's a 37 kilo, 4-year-old bull Arab, and he's in today for a bilateral orchirectomy procedure. Let me hang the rebreathing tubes up just out of the way for a moment. Maybe we just pop it around here. Beautiful. Now I have a kidney dish filled with various syringes and needles here, and I have sterile water for injection, where I'll be simulating the pre-medication that I'll be drawing up, which would be atrocide. So I have my calculator here, and I have a few alcohol swabs too, as we will be wiping the multi-vial. So his body weight is 37. Then the dose rate, as per the veterinarian, is 0.03 of atrocide, and then we want to divide that by the concentration as 0.65. So that is 1.7 mils of atrocide. We'll begin first by wiping the multi-use vial, making sure it's just clean and free from any foreign debris or dust. Then we want to sterilely open these needles and syringes, making sure you are not touching the hub or the syringe end in any way. You can discard that one. We then remove the carton and we draw here to the 1.7 mil line. Well, you draw back and then you push forward to the 1.7 mil line so you are accurate with your dosing. Want to remove that one. Then, using the one-handed scoop method, we want to recap the needle there. We then want to remove this needle, and we want to get a fresh needle, which is sterile, and we want to place that one there. As per our clinic policy, they do like to leave the plastic available to show that it is a brand new needle that has been replaced. So we'll place that one to the side, and then we will get our alcohol swab again, and we will just wipe over that multi-vial dose, just to make sure it is clean for the next use. We will then discard this one. This one will get discarded in the sharps container, and everything else will get placed away as per our clinic policy. But other than that, that is everything today. That is ACBN Practical Assessment 31, Setting Up for Anaesthesia, Attempt 2.